POA and Fit Body Bootcamp communities. What's up, everybody? Robert Linkul, trainingtheolderadult.com. I hope you're all doing great. We are here today to dive into a limitation and injury that a lot of our clients have experienced, our personal clients in-house, but also a lot of your clients have experienced. This has been I would say, a high demand topic, as I've done many individual emails or voice recordings out to different coaches and trainers discussing how to deal with this injury in particular, and then pre and post surgeries, all of that. And I just so happen to have a client who has had not one but two surgeries of this exact same injury, and we are going through the process of rebuilding her back into the world of resistance training. Now, with all of these, as we look into an article or a topic or an injury or a disease or whatever it is, we're always looking at it through our personal trainer / coach, strength coach mindset of, we're not here to diagnose this injury. That's already been done. How are we going to use our tools and our strategies of resistance training to help improve their quality of life in either prepping them for surgical intervention or post? Also utilizing our physical therapist and behavior counselors and doctors and everybody else that's in this team to help our clients rebuild their way back. We are a very big cog in that wheel, the most important in my opinion, because we get to see them so often and we have such a direct effect with them here on the floor. So keep that in mind. We're not diagnosing. We're here to say, here's the injury, here's the issue. Let's discuss that, make sure everybody knows what we're talking about. And then in the world of what we do, here's what we can handle and how we can help. All right, the injury here, bunions. Bunions are a very big issue. I'll give you some stats and such here in just a moment. This article on the right is a couple of little exercises and insight on how to strengthen the foot, reduce pain, improve mobility. It's very, very basic, and these are just basically body weight or foot exercises that this is kind of like a handout component for clients that are recently diagnosed with bunions, etc., to start working on improving their foot strength and their mobility. Because as this injury continues, persists, gets worse, range of motion and pain tolerance. Range of motion decreases, pain tolerance increases. Pain tolerance decreases as well. This gets really, really uncomfortable, and people start to struggle quite a bit. Now, I looked for some studies on this, and I'm not going to say the best one, but one of the more recent ones that I found was this non-surgical management of hallux valgus, which is a variation of a more common bunion, and what they did here in-house with some community dwelling folks. So just to give you a big overview of this really quick, 28 community dwelling women, average age of 60, were implemented into a 12-week program where they assessed and measured how comfortable, pain tolerance, foot strength, stability, overall quality of life, etc. They evaluated them at the start, at 4 weeks, at 8 weeks, at 12 weeks. And during that time, they were giving them different footwears to assist in how their foot is handling the bunion. So it might have been a different type of shoe or some type of prosthetic component that would attach to it to help modify or mold. It's different exercises they were doing, and then different stretches, etc., to assist. Now, during that 12-week period, there were this was during the COVID stay-at-home orders. So there were 2 stay-at-home orders that came through. You can see the dates there from July 21 through April 22. There were 2 stay-at-home orders that kind of went into that period where, when they were doing these studies, it kind of broke up what they were doing, and so they weren't able to get great results. And they mentioned in here like, oh, we're going to redo this, but it was feasible for them to be able to implement this. They just needed more time to do that. So I guess the takeaway from this is studies are being done and practices are being done to assist people with their bunions and to help, I would guess, say, early detection of this and what can be done with something as simple as foot care and footwear all the way up to surgical interventions, okay? So what is a bunion? Bunion is basically a big bony bump that forms at the base of your big toe. There is a variation of a bunion that can go on the the pinky toe. We'll show you that here in a moment. And it begins to develop on the inside edge of your big toe joint. And that joint has a very large impact on how well you balance and coordinate and propel yourself through this world. So your hallux joint, the big toe, is pretty vital. I'm going to say up to 50%, kind of just putting a number on it, of your balance and foot stability goes through just your big toe. It's very strong. It's probably the strongest of all of your toes, and excuse me, really needs to be taken care of. Okay. Now, as you looking to the right here, you'll see that protrusion of the bone and that bump as it starts to develop on the first metatarsal. And because of the development of it, it starts to deform, it starts to bow out. As it bows out, the countering mechanics of this with the distal phalange will start to medially drift, okay, or excuse me, distally drift, start to laterally kind of rotate out towards your other phalanges, your other toes. And this causes some pretty severe deformities. You'll see here in a moment, I have a rather disturbing photo of a foot progression. And so it's pretty uncomfortable to look at, but I'll warn you when we get there, okay? A bulge at the base of the big toe. It'll be dull, it'll be achy. These are symptoms. There will be some redness and even swelling to it. It may look like it's infected. There will be numbness and or tingling, can be very painful, even a burning sensation. Now, a lot of these are caused because of arthritis that you already have. In many, many cases, especially for you ladies wearing high heels or really tight toe boxed shoes are a huge cause for this. And the high heels and the tight shoe component, unfortunately, is probably one of the most contributing factors to this one. There are genetic components to this. This is something that can be, traced back to your DNA, your DNA. And unfortunately for some, if you are more predisposed to this, you're going to have to be a little bit more proactive, okay, to assist in that. Some of the more severe issues that can come from this is amputation if it's really bad. But what also kind of lends to this is if you have diabetes or if you have neuropathy and or both, and you get a cut or a break or damage to a toe, and that toe has to be amputated, which is rather common, for a lot of older people with diabetes or that have smoked and have neuropathy. They will lose a toe, and because that toe is now missing, the spacing in their foot is no longer supported by the space of the toe that's normally there. So now your other toes can spread and move and shift into different positions, making the accessibility of a bunion probably greater, I would say, as there's more movement, okay, towards the remaining toes, as it says there. Treatments are supportive and well-fitting shoes, wider toe boxes, or some type of orthotic that you can insert into your shoe, or a orthotic brace that you can attach to your foot. I'll show you these in a moment. Doing any type of medications, either over the counter or prescription, to assist in pain and swelling. And then you have your surgical interventions that will come from there. Okay, we talked about the causes a bit, but specifically a little bit more the narrow shoes that come down to a point. Really, really difficult to wear those over years and years and years, and all the foot pressure just from your body weight, but also the impacts of every step that you take. Just simply the way that you walk may have a mechanical component to it. If you have arthritis in your hips, if you have lower back pain, if you have knee pain, any of the extremities above your feet can cause you to take different gait steps, striated steps, etc. That may make your foot contacts on the ground different, and that can start to affect the boniness of your foot and where pressures are being put and what your body will then react to, in some cases creating a bunion to do so. Health conditions that cause inflammation like rheumatoid arthritis or lupus, it's never lupus. Sometimes it's lupus. That's a House joke. If you haven't watched House, it's never lupus. That was the joke all the way through, whatever that was, 13 seasons or whatnot. Standing for long periods of time and or working on your feet, okay? And we talked again about a lot of the symptoms of it, the pains, the discomforts, etc. And one more here before our disturbing photo. Different types of bunions. We talked about that. The big toe, kind of being the main one. A tailor's bunion is or a bunionette is one that based and develops on the pinky toe. So if you look at the picture here on the right, see the little bump on the right there on the pinky toe? So that would be a tailor's bunion or a bunionette that'll occur on that side. And we talked a little bit about risk factors with this. People whose biological parents have bunions or issues with their feet are 70% more likely to experience one themselves basically as they go. People with foot injuries and history of having a lot of foot contacts, basically athletes, you've been stepped on a lot, rugby, football, soccer, etc. All sports where you're getting lots of foot contacts, ground contacts, etc. Right? All right. Here comes the photo. When I say disturbing, it's not, I mean, you're not going to see anything terrible, but it's not a pretty picture. This is a progression of feet, starting with a normal foot and progressing to a severe bunion. Just be ready. Okay, here it comes. All right. Starting on the left, bunion stages. That's a mild or a fairly normal foot of the skeletal image I have laid over a healthy foot over that. The mild condition is under it, and you can see based on where the skeletal picture that I put up there versus the foot underneath it, there's already a slight little deviation. You can see that little tiny on the big toe is starting to turn in just a little, and that bunion's starting to develop by pushing out. That's why it says mild. So right there, okay, everybody see that right there? That's where it's just a little mild start. Moderate, it's going to start to deviate even more bone development. It's really going to start to push out. And then kind of a level 2 moderate, you can see the severe level of hook that's starting to occur as that big toe and the distal phalange starts to really push in to the 4 other toes. And then the metatarsal bone is really starting to deviate out. This is where your quote unquote deformity of the foot at this point, if you haven't caught it already, is going to need some type of intervention. And the ones that we've seen, I'll show you a picture in a sec too, are these braces that you can put on the foot. And there's a crank rotation type thing that will slowly, almost like braces for your teeth. I had one of those spacers for my mouth, for the roof of my mouth, and I had to put a key into it and then turn it, push it back every day. And it spaced my mouth slowly, like a millimeter at a day or whatever it was, slowly expanded the bony part of my mouth. Very similar here. They could put this brace on there and crank it, and every day they do a little turn, and it'll slowly start to manipulate your foot back to kind of a normal or healthy alignment. But if you don't catch this early and we don't get, we don't get a pretty consistent intervention starting to address this foot, it's going to take off on you. And so here's the next level that we're going to see where a large bunion has developed. And notice the big toe now, middle picture, okay? The big toe has now started to loop under the next digit. And as that continues under the large severity, it'll continue to hook out until full severity, where the big toe has gone all the way under. And that's the picture that I find to be a little bit disturbing, or a lot disturbing. And I have had a client that not only had that happen to her on one foot, but on both. The surgery was major. And talk about seeing photos before and after. A foot that, is this size to start would be that size after, so swollen, so aggravated. Slices, cuts, breaks, shoving everything. I mean, basically just rebuilding your foot. Pins and hinges, and it looks like door equipment, like a hinge you would see on a door. Something like that that's being bolted and screwed in there to make sure that the toe is going to stay straight and only move in that sagittal action. It's not going to drift and push out. And then bracing, connecting other things. It's a big time surgery. So when people have those, recovery from this is going to be quite difficult, okay? So let's talk about that a little bit. Plantar flexion, when you're standing, this is plantar flexion. When you go to your toes and you're like, oh, look at those calves, right? Somebody does a little toe pump. That's plantar flexion. You're planting your toes down on the ground. Heels come up off the floor. So your only class 2 lever in your body, well, not your only one, but your most commonly found. I think there's another one in your shoulder. The scapula is a little bit of at some angle has a class 2 in it. Class 2 means like a wheelbarrow, okay? There's a hinge, your foot on the floor. The weight is in the center of you, and then behind is where the lever that pulls you up, like a wheelbarrow when you pick it up. So that plantar flexion is going to cause that hallucis joint to flex into the floor and create range. Now, if you have inflammation, swelling, bone, spur, etc., that's now created this big bunion and starting to change the angle of that, it's going to hurt. Because it hurts, you're not going to want to do it. When you stop doing it, what happens? It's the use it or lose it mentality here. If we're not going to practice big toe flexion, you're going to lose big toe flexion. So if you lose that, what occurs on our end? We can't do lunges, can't do step ups or step downs, can't get up and down off the floor. These are all, not efficiently anyhow, these are all big toe flexing positions onto the ground. Your ability to ground react, that means push off the floor and drive, becomes really minimal on that foot. Or it comes with such a negative association of pain and discomfort that you just simply don't want to do it anymore. And so the avoidance now becomes a big issue, not using that foot or not doing that particular movement. Well, this makes us very unstable, and fall risk becomes to creep in big time, okay? So lunges, split squats, calf pumps, all that will hurt. We won't want to do them. Your alternatives now to train your lower body are going to be a quad extension machine, a hamstring machine, something where you don't have toe contact on the ground. So we're going to lose a functional component in that because we're really not doing the stuff we should do for daily life. Yes, we can keep our quads and hamstrings and calves working by doing some of the machines as good of a return as we would like to have. Medical intervention is needed for most cases. Again, you have to find out really early on, I've got a bunion developing, and you need to start taking care of it right then and there, or else you saw the severity chart, it'll work up. And once you get to like mild severity, you're going to have some kind of intervention at some point. Surgeries are drastic, as we said. There's shaving, cutting, rebuilding, etc. Casts and braces they can use to deviate as well. And bone manipulation takes a lot of time to perform, but not only that, to recover from. All right, most foot care poor foot care is a very common cause for bunions. I'm talking the simplicities of practicing toe breaks, right? Lunges, step-ups, calf pumps, etc. Practicing that on a regular basis. That's part of foot care. When we say foot care, that doesn't just mean like how nice do your feet look, okay? Are you getting pedicures or manicure, whatever, whichever one that is, pedicure, I think. So that's a part of it, and we want to take care of our skin and this and that, but also just therapy basically for the joint and the feet needs to be done on a fairly regular basis. You only have 2 feet, and they are literally carrying you through this world. So we should take care of these as they're the foundation in which our bodies are built off of, okay? If you have poor shoe selection, this is going to cause a lot of damage to your feet. This is going to ultimately cause pain in your knees and your hips, and everything else is going to stem up from that. When we talk about the foundation of a house, if the foundation of the house starts to crack and break, what happens to the walls and everything starts to shift? Everything above, if the foundation is damaged, everything above is going to suffer as well. So we got to make sure that the foot selection, the shoe selection that you're putting your feet into, number one, even if it's like, well, they're not as cute of shoes or whatever, you've got to be able to weigh this and go, all right, maybe my calves aren't going to look as nice. I'm not going to be in as high of a heel. Maybe they're not as cute looking shoes with a wider toe box or a closed toe box, etc. This is your life. This is your body. This is pain tolerance, etc. I understand that there are certain looks, etc., that we want to look for, but I just think it's a huge priority for you to emphasize, pick shoe selection based on comfort, not necessarily fashion, okay? And again, I know in some professions and such, that's difficult. I get it. So make sure your shoes are as appropriate as you can. And then do daily foot care. I have a video on YouTube of my routine that I do for my feet. This is something that I think women definitely do more than men. They tend to, in the societal norms as well, women tend to take care of their feet more than men do. It's not seen as a very macho thing to do to take care of your feet. Guys, take care of your feet. A little bit of lotion every night. Lotion your feet before you go to bed. Just doing that will help and take care of so much. Dry skin, ashy skin, any type of callus or buildup, etc. Just like your hands, if you exercise, you work in the yard, you do stuff, you'll get calluses on your hands because there's a demand being placed on them. We grab rough stuff, hot stuff, hard things, rigid things. So your body goes, we'll give you more skin there to help you with that. We'll help you build gloves, basically. Your feet are doing the same thing. Pushing on the ground, a lot of contacts, pressures. I'm wearing work boots or high heels or whatever it is. So the body will start to adapt and say, here's some more skin, here's some more skin, here's some more calcium. Let's densen up these bones. They're getting banged up a lot. Well, in this instance, we're kind of our own worst enemy, and that's causing a lot of the issue. So if we don't take care of that, that can carry away. We've seen a lot of foot injuries, foot amputations, toe amputations due to poor foot care, period. It doesn't have to do with neuropathy or diabetes or anything else. You just don't take care of your feet. Your feet start to callus. Calluses build up. You don't get rid of them. They crack. As they start to crack, you don't treat them. They get infected. That infection turns septic, and there goes your toe. Or worse, you get blood poisoning, and it could kill you, okay? You go into shock, you have a stroke. There's all kinds of stuff that could occur from that, and this is a very real thing. This happens often. 2 members of my family, immediate family, have had that over the last 3 or 4 years. We've had amputations due to it. We've had all kinds of issues. Again, these are diabetic neuropathy-based cases, but nonetheless, if you don't take care of your feet with the basics of what can I visually see every day? I can trim my nails every week, make sure my nails are staying nice and healthy. I can, shave and file down my heels and the calluses on the side and the bottom of my feet, lotion them up when you get done, and put any treatment on there if you need. There are different products you can get out there for. I have dry skin, I have irritated skin, athlete's foot, ashy, whatever it is. There's different tools that you can use, different spray bottles or ointments or lotions that you can put on your feet to help treat these things. And a little bit every day will go a long way. What we don't want are calloused, scabbed, cracking, yellow, jaundicey looking feet with toenail infections and dirt and ingrown hairs, and it's just a disaster. And your feet start to go, everything else above it is going to suffer, okay? There's my rant for the day. Daily foot care is key, as we talked about. And again, yes, we have some hereditary issues. So, final takeaway. What do we need to do in the weight room here to accommodate this? Something like a wedge could be very, very helpful. We have wedges in-house. My wedge is right there. This guy up on the wall, that's my wedge right here, where my finger is. That wedge, it's a platform you tilt down, and there's ramps. And the ramp has different intensities, different heights, 15, 30, 45 degrees, based on how far we put our foot up the ramp. Those wedges can help quite a bit by reducing hallucis pressure, but also increasing and aiding in range of motion as you're basically jacking the floor up, right? Rather than moving the person's foot up. It's kind of a way to pre-expose their foot to range of motion, but give it support at the same time. So using wedges are really good to squat or lunge, or even to do little calf pumps with an elevated toe just to create greater stretch. Again, we have to use this or lose this, as I put there at the bottom. So with tolerance, okay, and proper care and other endeavors to make sure we're doing medically what we need to do to take care of our feet, in-house, training hallucis range of motion, calf pumps, plantar flexions, change multi-direction, lateral step outs, forward step outs, drop step back out, step outs, pushing the tank, big full ranges of motion, short choppy little ranges of motion, okay? Split stances when we're rowing or pushing or pressing, kickstand when we do an RDL, one toe way up, the other foot completely flat. These are all real life movement patterns that we do on a daily basis. And if we don't train for them, we won't be very good at them, let alone maintain or keep the ability to do so. If you have clients that have got to the point where a medical intervention or something more severe, braces, medications, etc., not more severe than surgery, that's about as high as you can get, but more medical intervention engagement is needed. What we can start to do in-house then is accommodate the client by making some changes to their foot position so they can continue to train while getting that treatment at the same time. In this case, it might be suspending the client's foot off the ground so they don't have toe engagement. Maybe we're at a point where it hurts so much that they simply don't want to put it through any range of motion. And so it's like, I either don't train my lower body or let's find some alternatives. That's where elevating your heels when you squat or when you perform, certain lifts, hinges, rack pulls, deadlifts, etc., can help take some of the pressure off the toes and shift it back onto the heels. Using suspension straps like a TRX where you put their foot in the strap, rear leg when they do a split squat, okay? This will give them the chance to still do split squats in a Bulgarian, split squat fashion, which is difficult, but there's no toe contact on the floor. Or simply putting their foot up on a box behind them rather high, shoelaces down so the bottom of the foot points up, and now their toe can just stay straight, and you can kind of lever back and sit back on that leg and still train, some split squat variations. Training the gait is a big and valuable component to this. So maybe even with this client, taking a video of them with your cell phone as they walk, their natural gait, and then being able to time that and even measure it in distance. We do a 10-step distance gait test. They start with their heels against the wall, and then they just walk 1, 2, 3, 4. They take 10 steps. Wherever that ends at, right at 10, we measure that. Let's say it's 30 feet. Then you could say, well, your gait averages 3 feet per step. 30 divided by 10 is 3. So every step I take, 3 feet, 3 feet, 3 feet, 3 feet, that's my average. Is that really what it is? It might be, 34 inches on my left foot and 38 inches on my right foot. I might have a discrepancy in there, an asymmetry, but my average equals 36 inches, okay? So it's not perfect, but it's something. We can measure that. And then let's try to keep that ability as this process goes, if not better it, okay? But at least you have a starting point. And maybe literally taking photos of their feet and maybe seeing what kind of pain tolerance they have when they do a squat or a drop step lunge or a calf pump. Hey, on a 1 to 10 scale, what do we have? Give some kind of rating system. And then every 4 weeks or so, try to reassess these. Are we getting better? Are we getting worse? Should we go talk to the doctor and encourage more treatment on this, or are we making progress and we're going to do okay? So some ideas on how we can kind of place this in there. Assessing the gait and watching how someone walks, how they roll through their foot, what kind of ground contact they're making with their feet. Pretty important. It's a really good tool to use there. Multi-directional movement patterns. Like we talked about forward, lateral. We do clock drills where they'll hold weights like a farmer carry. 12 o'clock return, 1 o'clock return, 2 o'clock return, 3 o'clock return. But you don't just turn your body on the clock. You stay facing this way. And as you lateral step out and push back and drop step and push back, your foot has to keep changing. Your hips have to keep changing. Your lower body has to accommodate. The upper body stays put. And so now your foot gets all these different ground reactions. Now some will suggest, we should do some barefoot training. With bunions, that could be really uncomfortable and maybe more harm than good. Even if you have your socks on, stepping on rubber flooring or anything harder, probably going to just aggravate and make things worse. So I think having solid foot support, footwear, any braces, orthotics as needed, regular daily health care of your feet, continued modifications in the weight room, changing directions, gait assessments, working on your strength, along with these little toe exercises, trying to lift your toe up, return, spread your toes, return, spread your toes, return, gripping the toes, gripping the toes, gripping the toes. All of this will help keep a little bit more independence and capability, and then your calf pumps, of course, rolling up to the toes. It will help keep a little bit more independence, stability, ability, strength, and increase balance, or at least maintain balance. And then hopefully through whatever other interventions you're doing, regular health care and braces and orthotics and whatnot, the bunion doesn't take over your life and become this feature of discomfort and pain in your body and your feet because it just affects everything. Now you're like, I don't want to go for a walk every day. My foot hurts. No, I'm not going to go be social and hang out with my friends because my foot hurts. No, I'm not going to take that vacation. So now you start missing out on all these great things in life that could be, because pain is now dictating what you're capable of, what you're going to go and do. Pain is now dictating the opportunities and experiences you have. And this sucks. It's a shit way, to kind of live your life. I've been there with my hips and with my back and all that, and it's still a daily struggle with pain tolerance and discomfort. Everybody has flare-ups. Everybody has their issue. So you've probably all experienced that too. But think of this now. If I have a hand or a wrist or a shoulder injury, I can kind of nullify that by bracing it or holding it close to me. But my feet, anything and everything I do, other than sitting in a lazy boy, it's going to hurt. Anything that I'm going to go and try to experience or participate in, or stand or sit or manipulate or move or push or pull, it's through your feet. So when I see that people don't, and I guess this is where I really get aggravated with this, because we see some of the statistics, it's like a lot of this is self-damage because you didn't take care of your feet early on. Just a little bit, a couple of minutes, not even that, a minute or two every day, to just right before you go to bed, take a look at your feet. How do my nails look? Trim if I need to, right? I put down a little towel next to the bed. Trim. Got my file out, little file here and there, get rid of any calluses. Grab my lotion the hands, lotion the feet up. You're good to go. Okay, once a week you do a full nail trim, do a full inspection, massage of your feet. Go get a pedicure once a month, something like that. Nothing wrong with that. Take care of your feet. Super important, because your quality of life and life itself is now occurring on those. Really need to take care of them. So I get a little frustrated when people, they'll come in, my feet, my this and that, and then I see their feet and I'm like, wow, when was the last time you did anything here for your feet? I don't do anything for it's too macho of a mentality, especially you guys, too macho. Go get your feet worked on. Go get some help with this. This one's really important. You start losing digits, quality of life is going to go down. Your ability to participate and do anything is going to follow as it slowly, life opportunities are start to dwindle. And that, as we know, statistically speaking, leads to earlier mortality rates, poor quality of life. People don't stick around as long. All right, this was a fairly deep dive into the world of bunions. I hope you got some good information from it and some ideas and strategies in-house here that you can start to do. Use your team, medical doctors, podiatrists, your therapist, etc., physical therapist, etc. Use your team, be a part of that team, work within the group, learn what we should and shouldn't do for that particular person, when they're having interventions, when they're going to have surgeries, what to do before and after, etc. Work within the team, do the best you can for your people, and do daily health care. Take care of yourself, do the best you can here to improve your quality of life so we avoid this and we don't become a statistic. Comments, questions, hit me up down below. If not, please ring the bell, share, send this out. Anybody in your life that needs to hear this, I hope it helps. I love and appreciate all of you, and thank you for being a part of our community. And until next time, continue to fight your good fight against sarcopenia. Take care.